intermenstrual bleeding and postmenopausal bleeding. So when we are going further, we will be able to discuss it further, and it will be there. No worries about it. I hope you all are doing well and enjoying the rainy season as well. इसके अलावा मैं कुछ और कह नहीं सकती. The place where I'm sitting is a hot air oven because the air conditioners are not working. So bear with me when I wipe myself with the tissue and rest of the stuff. टॉपिक है आज का नॉर्मल यूट्राइन ब्लीडिंग. मेरी स्लाइड में जो पहली स्लाइड आप देख रहे हैं वो है डिस्क्लेमर. डिस्क्लेमर मैंने क्यों यूज़ किया है? डिस्क्लेमर मैंने इसलिए यूज़ किया है कि मैंने कुछ स्लाइड्स जो हैं वो फिगो यानी फेडरेशन ऑफ इंटरनेशनल गायनेकोलॉजी एंड obstetrics की वेबसाइट से ली है. इसी तरह कुछ स्लाइड्स जो हैं वो अमेरिकन जर्नल ऑफ ऑब्स एंड गायनी की वेबसाइट से ली गई हैं इन ऑर्डर टू increase the visibility as well as to add material to these slides. I have taken few slides from these two websites. मैंने आप सब में ये भी लिखा है कि these slides have been in public domain for educational purposes. I hope you understand these 3 points very well. If I have taken the slide from somewhere, I need to acknowledge it. Number one. Number two, I have also to acknowledge that these are in public domain. That means I have not taken someone's personal property for my personal use. And the other thing you have to say is that the slides are in public domain. These are the 3 basic steps where you will be avoiding plagiarism, जो एक आपको लेबल लग जाता है, उसके लिए ये बहुत ज़रूरी है कि आप एक्नॉलेज करें कि आपने स्लाइड्स कहाँ से लिया. So I hope you understand why did I put up a disclaimer here, and this should be your practice as well once you are entering in the therapy. How do you define normal uterine bleeding? The prevalence is something like 14% in women in their reproductive years. And what do we understand by the term reproductive years? We understand that by reproductive years, it means the years from 18 to 45 years of age is called as the reproductive years. So it affects around 14%. This 14% is coming out from United States. What is prevalence in our part of the world is not known exactly in figures, but we are also ranging between 15 to 20%. So the most common thing which we are seeing here in our part when we are doing the outpatient is women coming with different forms of bleeding. And how does it affect the woman? It not only affects their quality of life by creating significant physical, emotional, sexual, social, and financial burdens. So, if a woman is bleeding from beyond her normal menstrual days, that makes her upset. That also brings her to the doctor to seek some advice.
alaikum.
अस्सलाम अस्सलाम वालेकुम।
वालेकुम
राइट
सलाम।
शो हो रही है आपके पास?
जी जी जी, शो हो रही है मेरे पास।
जी, थैंक यू।
फुल स्क्रीन कर
बोला
दें? हो
स्क्रीन कितनी है?
हो गए।
Sorry for the interruption. The lights went off, and so we left here. And yes, here. I hope you guys are there. So when we say abnormal uterine bleeding, it's a combination of heavy menstrual bleeding, intermenstrual bleeding. So if someone asks you what is the definition, so we can say combination of both heavy and prolonged menstrual bleeding can be labeled as the abnormal uterine bleeding. When we say heavy, so we need also to identify um, what is the normal blood loss, and we also need to identify what is meant by the prolonged bleeding. So the normal menstrual period. The normal menstrual period, the blood loss should be more than 80 milliliters. It's very difficult to quantify the blood loss at the time of menstruation. So there are a number of different methods by which people uh, calculate the amount of the blood loss. So these methods are very crude, not practical for day-to-day life. Say, for example, you will be giving the free weight pads, sanitary napkins to the lady, and then after she's finished with her day, you can ask her to bring it back to you, and then you are going to weigh it back. So you can understand how cumbersome it will be for the woman to collect it, and also at the other end to weigh them again and to find it out. And this will tell you how much is the amount of the blood loss. So there are a number of other methods by which people identify the how much has been the blood loss. So it can be from the hemoglobin concentration, it can be from the serum ferritin levels that can indicate. And before that, lab investigations come, you can also find it out from the symptoms of the woman that is she having easy fatigability, palpitations, pallor, and there is anemia. There are other things by which you can assess how much is the amount of the blood. Duration of the flow is important because when we say that it's going to be prolonged, that means then we need to understand what is the normal length of the cycle. The normal length of the cycle is between 24 to 38 days, and the duration of the flow should not exceed 8 days. So it's from 4 to 8 days. Sometimes the girls come to us and say that they have not blood enough or they're not bleeding enough in these days. So when you ask them how much for how many days we have bled and how many days, how many napkins we have changed, you can identify from there that they are having normal cycle, there is virtually no limit. So you must understand that it's the duration of the flow should be between 4 to 8 days. It should not exceed 8 days, and then the cycle length it should not exceed 38 normal things. So when this, after understanding this, we move on to the other thing. This is the slide which is basically from the embryology book that how does the endometrium is behaving. So there are two things in it. The lower down, if you can see the cursor as I'm sharing the screen and the slides with you, this is the endometrium which is undergoing changes during the menstrual cycle, and this is the ovarian tissue which is undergoing the changes during the cycle. So we have two phases: a follicular phase which lasts for good 14 days, and then we have the luteal phase, which under the influence of the luteinizing hormones. During these two phases, the endometrium is growing, so it keeps on growing, the glands keeps on growing, and as a result of it, the endometrium enlarges. So once the when the cycle length reaches its 28 days, the hormonal levels are withdrawn. So the LH is and the FSH surges making estradiol and progesterone. They are withdrawn. As a result of which, when they are withdrawn, all these endometrial glands which have grown, they start shedding and the menstrual cycle starts. This is the normal phenomena which happens in each menstrual cycle. I hope I made it clear to you that this endometrium is growing under the influence of the estrogen and the progesterone. Similarly, the hormones which are there are the FSH and the LH coming out from the pituitary, which are making the ovary secrete these hormones, and as a result of which, the this is growing. And once the hormones are withdrawn at the end of the cycle, at the 28th day of cycle, the endometrium starts shedding, as a result of which the menstrual cycle starts. So this is something which is known as the normal menstrual phenomena. Um, when we say the abnormal uterine bleeding, what do we understand by it? The abnormal uterine bleeding has been classified by the International Society of Gynecology and Obstetrician in 2018 as their Congress, which was held in Italy. They classified the abnormal uterine bleeding as palm point. So if you can understand palm, 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 and point, COEIN. So when we say this thing, this is basically the structural changes which may lead to abnormal uterine bleeding, and these are the non-structural changes which can lead to abnormal uterine bleeding. So what can be the structural changes when we call it? P stands for colon. A stands for adenomyosis, meaning that simply it is defined as if a woman is giving birth to 8 or 9 children, the myometrium undergoes hyperplasia. As a result of which, the myometrium undergoes enlargement, and the uterus, as a result, also get enlarged and results in adenomyosis. Leiomyoma meaning fibroid uterus, and then there can be malignancy and hyperplasia. So these are the definitions of the point. Coagulopathy, C stands for coagulopathy. What do you understand by coagulopathy? Meaning that it can be inherited bleeding disorders. It can be if a woman is having anticoagulant drugs, she can also bleed, but that will come under iatrogenic. Similarly, there can be ovulatory dysfunction such as polycystic ovary. There can be endometrial pathology for uh, abnormal uterine bleeding. Iatrogenic meaning, say for example, someone has undergone a change in heart valves, as a result of which the she's on anticoagulants. When she's taking anticoagulants like warfarin and other drugs, what can happen? It can lead to this thing, abnormal uterine bleeding, not otherwise classified, meaning that you are not able to identify what is the reason for it. But this is usually seen in very few circumstances. So if someone asks you about what is palm point, I hope you will be able to define what is meant by it. This is the FIGO classification for abnormal uterine bleeding. This is one of the view of the endometrial polyps also when we said P stand.
मैम म्यूट हो गई हैं.
The polyps look like on hysteroscopy like this. This is also one of the causes of abnormal uterine bleeding. This is how the polyp will look if we are going for a transvaginal ultrasound or sonography. This is how the polyp is going to look like. So this is a view of uterus in transvaginal ultrasound, and this one is showing as the polyp. Similarly, on a sonohysterography, we can also see this is one of the polyps. So this is how it's looking. These pictures have just been introduced to the fact that since we are not able to have one-to-one interaction in the departments, as a result of it, we are unable to um, sort of show you all these things. As a result of which these pictures have been introduced. So, if you want to evaluate a woman who is having abnormal uterine bleeding, how are you going to start up the thing? So, when you are evaluating a woman for abnormal uterine bleeding, you have to see for certain things. So first of all, you need to take a complete history for how long the woman has been having these symptoms, for how many months she has been having these symptoms. Um, and were the cycles regular from the beginning or they were irregular from the beginning. Sometimes the women say the cycles had been irregular from the beginning, or she has undergone some form of surgery or has taken some form of treatment for a very long period, as a result of which she has started changes in her menstrual cycle. We have also to rule out symptoms like if the woman is overweight, we should be able to calculate what is her body mass index. Is she falling in the base category? Is she having polycystic ovarian syndrome, hyperprolactinemia, or hypothyroidism? These all can be assessed from the history, that history and a physical examination, that if the woman is having polycystic ovaries or not, or sometimes they may be having chronic medical illness. What do we understand by chronic medical illness is that women in their reproductive age groups after 40 years of age may suffer from hypertension, they may have diabetes, and similarly, they may have hypercholesteremia. All these medical conditions can lead to changes in the menstrual cycle, and it's not only we get referrals from the physicians that these women are having changes in their menstrual cycle, but when we come across these women, they are having uncontrolled blood pressure, they're also having uncontrolled cholesterol levels and uncontrolled diabetes. Once you control these medical conditions, then the abnormal uterine bleeding also improves in this group of women. At times, the woman may be having some form of medication which is resulting in abnormal uterine bleeding. This may be um, it happens especially the women who have given birth and have taken different forms of contraception. Sometimes they miss their doses of contraception, or sometimes what happens that they have taken it in the wrong manner. As a result of it, it may end up in um, abnormal uterine bleeding. They may have this may result in um, uh, uh, different cycles which are not normal. So, what happens? Say, for example, if we take an example of the oral contraceptive pill, there are marks on it that you have to take the medications according to it. So, it has arrows on it. So the arrows move from left to right, then it goes down, and then from it comes back from right to left. This is not seen in normal cases. As a result of it, the woman may take the drug from wherever she wants to take it. So she may be taking it from the middle. She may start it taking from the right hand side instead of taking it from the left hand side. And all these individual pills have got different levels of estrogen and progesterone, as a result of which once they start taking it from different instead of the normal arrow findings, if they take it in another manner they will have abnormal uterine bleeding. So once you have seen that the woman is not taking the drug properly, you will ask her to go down this path and start it all fresh from with the new bag and wait for the periods to start. Similarly, those women who are on tamoxifen, the tamoxifen is a drug which is given for a woman who has undergone treatment for breast cancer. So the tamoxifen has to be taken for the lifelong period. So they should take tamoxifen twice daily for lifelong in order to keep the cancer cells at bay from the woman. The what happens is that those women who have who are on tamoxifen therapy, what happens is that the endometrium also undergoes hyperplasia and they can have abnormal uterine bleeding. So you have to take a proper history that is the woman on some form of medications or not. Or sometimes happens the women are taking medications for hypothyroidism and they stop it on their own. They will not ask the doctors, and the thyroid levels are uncontrolled as a result of it. Also, they will have amenorrhea, or they may have periods of amenorrhea followed by periods of heavy and prolonged menstrual cycles. So you need to take a proper history that what the woman is taking in these drugs, and the women have these days people have a very strong habit of taking herbal medicine without knowing what they can take. Similarly, there can be coagulation disorders. We will be coming back to it in the last, how inherited bleeding disorders and what type of inherited bleeding disorders can lead to abnormal uterine bleeding. If such a woman comes to you in the outpatient, what are the different things which need to be examined? So the woman needs to have, first of all, you will like to have vital signs like blood pressure, like pulse, to see how is she being fit, see what is the importance of the pulse. The pulse will be raised in cases if a woman is anemic. If a woman is having a hemoglobin concentration of 8 grams or 7 grams, the pulse will be above 100. So that is what it is going to tell you. Similarly, you need to know what is the body mass index of the woman. If the woman is overweight or obese, she's also going to have a lot of issues with the cycle. In the neck, you would like to examine for thyroid enlargement to see if the woman is having thyroid issues. In the abdomen, you would like to see whether there is any tenderness, there is any palpable mass, or like a fibroid uterus. You need to identify this by doing a for abdominal examination. And then when you are also doing examination, you can also you're also looking whether the woman is having skin pallor. There is petechiae. What does petechiae stands for? These are the small patches which are seen when the woman is having a low platelet count. So if I tweeze my skin, it may get bruised a little, and then it may, after some time, it will be all right. It doesn't mean that I'm having a platelet disorder. The size of the petechiae is important. How much is the size of the petechiae? And is it the size of a coin, or is it the size of a small uh, 0.5 millimeter, or these sizes of petechiae spread all over uniformly over the body? Then it indicates that the woman is having some form of platelet disorder. Similarly, if the woman is obese, there can be signs of hirsutism and polycystic ovaries. You can find out that the woman may be having a male hair distribution, ecdysis nigricans, which are the black spots which are seen in different parts of the body. So these all things can be signed in some of polycystic ovary. So and once you have done the general examination, then you will move on to the pelvic examination, a bimanual pelvic examination to see what is the what are the findings. So when we do a bimanual pelvic examination, before that we will have to do upper speculum examination. Upper speculum examination means we need to introduce a cuscal speculum and to see that is there anything abnormal on examination. So once you introduce upper speculum or once you introduce the cuscal speculum, the first thing with which you and if you have introduced it correctly, well, the first thing which you see is the cervix. The cervix is uh, the first thing which appears. If there is any cervical pathology, the you can see at that moment. Similarly, if there is any cervical polyp, you can also see that at moment. Similarly, if there is any vaginal growth or vaginal lesion, you can also see it on a first spectrum examination. If the woman had never had any pap smear in the past, at that time you can also see for the pap smear. You can also take pap smear. Once per speculum examination is done, the other thing which you need to do is to do a bimanual pelvic examination. After taking out the speculum, you will like to do a bimanual pelvic examination. What is meant by a bimanual pelvic examination? It means that your one hand is within the vagina and the other hand is on the abdomen to feel for the size of the uterus. The normal size of the uterus is between 7 to 8 centimeters. It is more than that, and if you are able to palpate it, if you are able to palpate it in the abdomen just above the symphysis pubis, then it means it is around 12 to 14 weeks size. A normal size uterus cannot be palpated in the abdomen. So if you are feeling the uterus in the abdomen, that means the uterus is enlarged and it's around 12 to 14 weeks size. It may be more than that if there is a fibroid uterus or there is any other lesion in the uterus. Similarly, there can be ovarian pathology and you can feel it on the lateral walls examination. You can see whether there is an adnexal masses or not. So we had a general examination, then we went on to the physical examination, then bimanual pelvic examination. Before that, we did upper spectrum examination to identify that there is no cervical or vaginal pathology. There are two basic things which we need to do once we order few labs for this group of the women. First of all, you have to identify that the woman is not pregnant and she is not bleeding because of the incomplete miscarriage or any other form of miscarriage. So you will get a better HCG that will indicate that the woman is pregnant or is not pregnant. Then we have to go for a complete blood count with platelets. So what does that mean? Complete blood count if the woman is having abnormal bleeding for a long time. Remember, what is the definition? Abnormal and heavy and prolonged bleeding will be termed as abnormal uterine bleeding. So this will lead to a decrease in the hemoglobin concentration. Platelet count once there is anemia, the platelet counts go up. Thrombocytosis in the event if the hemoglobin concentrations are low. If the platelet counts are low, that indicates that the woman is having some form of platelet disorder and we will be coming to it. Similarly, you will like also to have a thyroid test to find it out there is no thyroid issue in this group of women. Here we have also written free testosterone and prolactin. Free testosterone for those women who are in whom we found that she may be having polycystic ovaries. In real sense, In hirsutism, you will be having raised testosterone levels. Similarly, you will like to see what is the corresponding time and what is activated partial thromboplastin time, APTT and ATTT, to rule out von Willebrand disease or anything else. And you can do it simply from there here, from these three tests, from PT, APTT, and fibrinogen levels, you will be ruling out number of inherited bleeding disorders right from this panel. Similarly, I showed you in the beginning the slide showing that what will be the ultrasound looking like on TVS, transvaginal ultrasound. Similarly, there should be an office endometrial sampling if it is indicated. So there are a number of instruments which are available for office endometrial sampling, and one of such instruments is called Pipel. It's a small device which is available easily in the market. Now costs something between 700 to 800 rupees, and it shows that it takes out few pieces from the endometrium, and that can be submitted for histopathology to find it out that there is no endometrial pathology for this woman. We will be coming to how to manage abnormal uterine bleeding. Here I have shown you, this is the slide I've taken from your own book of it teaches that how to manage acute heavy menstrual bleeding. At times, the people come in a very a dramatic state in the outpatient where they're bleeding heavily, and they have been bleeding for a very long time, but they have not taken advice. By the time they come to you, they are having breathlessness, they are having fatigue. You find them that they are not having hemoglobin concentration. At times, we get women in whom we have hemoglobin concentration of not more than 2 gram or 3 grams. The first thing to do, and this is not very unusual in our setup at civil hospital where the woman is having a hemoglobin concentration of 2 or 3 grams, and they have been bleeding for a long time and they have not sought any medical advice. The first thing to do is to admit this to these people. Number one, maintain their intravenous lines, and so that they are able to maintain their uh, volume, the blood volume, the pelvic examination to identify what is the reason that they have been bleeding for this long. Similarly, you'll be sending the basic test which I introduced in the beginning, like complete blood picture, which will show you what is the hemoglobin concentration, is there any platelet effect. Similarly, you would like to send a prothrombin time, partial thromboplastin time, fibrinogen level if available. In the biochemistry, you would like to send at least a basic thyroid levels, TSH levels you need to see. Similarly, as we told in the beginning, that we will like to have intravenous access and resuscitation or transfusion. We will like to draw blood for cross matching and arranging. Similarly, you can give tranexamic acid. Maximum doses can be used. Say, if you want to, if you have admitted, you can give her 1 gram every 8 hourly, or 1 gram 12 hourly. The maximum dose which can be given is between 2 gram to 3 gram. You would like also to arrange for transvaginal ultrasound to indicate that there is no uterine or endometrial pathology. Then you have to give something, some form of hormonal treatment to control the acute blood loss which the woman is having. So you have to give her high dose progestin to arrest bleeding. Similarly, GnRH analogs can also be given to arrest bleeding, and in the meanwhile, you would like for the pandemic, as it most of the time is able to decrease the amount of the blood loss which happens. And in the longer term period, would like to give you the GnRH or high dose progesterone, and within 24 to 48 hours, you are usually able to reach a diagnosis that why this woman is having a increased amount of blood loss and why she has lost this much blood. And in the meantime, you must have also replenished her blood volume by transfusing her blood in the form of fat cells. So this table is showing that what are the medical treatments which are available for this group of women. So this is for acute
Hello? Hello?
हेलो वजहाद, अस्सलाम वालेकुम।
वालेकुम अस्सलाम।
हाँ यार, सॉरी यार, यहाँ की है जो है ना, आज थोड़ी लाइट तंग कर रही है।
अच्छा अच्छा, चलें कोई बात
एक
नहीं।
मिनट जरा वेट कर।
मैडम की जो है स्क्रीन शेयर करा दें।
Yeah, on it. Audio on it.
Yes, sir, mic on है. वजाहत वजाहत आवाज आ रही है.
जी
वजाहत आवाज आ रही है.
जी आवाज़ आ रही है आपकी।
ओके 7
My apologies as the light again went off and it takes a little while to restart the computers and other things. It gives us a break as well. Um, so here we were talking about this thing that what to do with if the woman comes with acute bleeding or acute blood loss. So either we can give her high doses oral progesterone, high doses progesterone or high doses intravenous estrogen. The CEE stands for conjugated equine estrogen. Estrogens in the injectable forms used to be available in earlier days, but not now. I have yet to use it in any patient because it's not available in our part of the world. Oral tranexamic acid or intravenous tranexamic acid, it can also be given intramuscular. Similarly, LHRH agonist, which we'll be talking about um, in a moment. Similarly, see here if you are seeing the we are sharing the screen with you. So if you see, consider 3 or 10 milliliters of intrauterine Foley's balloon for tamponade during acute period. We use this method and has been found to be very effective, especially in those young girls who are brought to us with acute blood loss, especially in children who start their first menstrual cycle. These are the children with von Willebrand disease or transverse thrombocythemia or Bernard Solier. These children bleed a lot at their first menstrual cycle. As a result of which they lost a lot of blood. We have reported on it, and I want to have like to show you. This is available in public domain, and you can read it as well. That here we used it in where a girl who had Glassman thrombocythemia and who was having acute blood loss. Nothing worked. So the original treatment for Glassman's thrombocythemia, it's one form of a bleeding disorder, is um, factor 7, which is very expensive and can be bought in bags. This woman received this. She was a child of, I think, around, if I remember correctly, 13 or 14 years, and was brought from an area of nearby Sindh, from Badin area, where she had a hemoglobin concentration of not more than 3 or 4. She received multiple doses of recombinant factor 7A, but the bleeding will not stop. It will stop for some time, for a day or two, and then it will restart again. And then she received multiple transfusions of platelet, and finally the bleeding stopped once we did a uterine tamponade with Foley's catheter, and the bleeding stopped. And this, from then on, we have been doing it for girls with the von Willebrand disease and others. So it has become become sort of a routine for us in those girls who are brought with inherited bleeding disorders of their first menstrual cycle or at the time of their menstrual cycle, that we usually do this form of tamponade to stop the bleeding. This is me. This is a hematologist who was also looking after the human part. And this gentleman was a final year student who was posted with us at that time in the unit in the department, and we took great care of this young girl, bringing her from the hospital and arranging a lot of things for her. And also did the literature search with me. And this gentleman is doing residency in the United States these days, Dr. Shimlal. So this is how the students come to do. So I get a lot of students who say that we want to work with you, we want to do something with you. So this is how we come across students, and then they become a part of uh, our write-ups and rest of the stuff. This is how the students can help us in um, writing things. So yes, this is for the acute condition. I hope you guys are with me and you are enjoying it. We have muted your mic, but you can send me a message in the chat box if you are not able to understand me for or you need to discuss some points. We can take notes, and when we will be answering, I will be answering your question in the end. I hope there are questions. Otherwise, I look a fool talking to the screen for past 45 minutes. It's very difficult to take actions on. I don't find it interesting. People may find it interesting, but I don't find it. The one-to-one interaction, the dialogue, the discourse, they are the best form of teaching for any teacher who is interested in teaching. So, coming back to your this thing. So, if the woman is not having acute status, so what are you going to do? So you have ovulatory, normal uterine bleeding with, like, you have women and who bleed heavily during their normal days, and you don't find any reason. So you have things like tranexamic acid, you have things like levonorgestrel releasing intrauterine system, you have combined oral contraceptive pills, you have continuous or cyclic progesterone, you can have injectable progestin, you have non-steroidal anti-inflammatory drugs, you have GnRH agonist. We'll be spending time on each of them for a while. Okay, be patient. Levonorgestrel intrauterine systems. I got a picture of it for you, and here it is. So this is how it looks like. This is known as the two arms are having unloaded with progesterone. The progesterone which is there is levonorgestrel, and it releases 20 microgram per day of progesterone, so it's going to be protective for the endometrium. Reduces blood loss by 90% in the first year of its use. When we are inserting it in the women, we usually tell them that it may cause irregular bleeding in first 3 to 4 months of its use. Women should be warned about it. That otherwise, you see, whenever we are having some form of treatment, so we think it's going to bring out relief to us immediately. We all want immediate relief, like the ad in the sunset. 60 seconds में आराम आ जाता है. Yes, the 60-second won't count. You have to tell them, otherwise they will lose faith in you and will say कि ये डॉक्टर ने कैसा इलाज किया है कि आराम नहीं आया है और अब तो और irregular हो गई हैं bleeding episodes. So you have to tell them. Similarly, if there is any submucosal fibroid or anything, it is going to come out. As a result of it, you need to understand that which women are suitable for levonorgestrel intrauterine systems. Okay, it is available in the market with the name of Mirena. Once it was introduced, it costed around 7.5 thousand. So as the dollar flew up and the rupee went on ventilator, the prices have now jumped to 11,500. So most of the time, our women who are coming to Civil Hospital Karachi are not able to afford it. And but it's one of the forms with which you can control the bleeding over a longer period of time. See, whenever you are treating a woman with a normal uterine bleeding, you need to ask two basic questions. One, have you completed your family? Are you interested in further childbearing? Do you want to have further childbearing? You want to conserve the uterus or your fertility. These are the two common things which you need to ask from the woman before you start planning the treatment modality for her. Coming back to this slide, tranexamic acid, we all understand given in the oral can be given intramuscular, the maximum, or it can be given intravenous. The maximum dose is between 2 to 3 grams daily. Combined oral contraceptive pills, depending on whether you will like to give it in a cyclic manner or whether you would like to give it in a continuous manner. If you want to give it in a continuous manner, you will like to give it for continuous 3 months. Remember, the oral contraceptive pills have got 4 rows of drugs. The 3 first rows are white in color. I'm talking about the commonest one which is available in the market with the name of Novodol or Femila 28. So it will be 3 rows of white pills and 1 row of brown pills. So the white pills are the ones which are carrying out the hormones, estrogen and progesterone in different combination, and uh, the other ones, the brown ones, are the ones which are having only uh, iron. So if you want to give it in a continuous manner, you will ask the woman to take the white pills continuously for 3 months. Similarly, if you want to give it in a cyclical manner, in the cyclical manner, you will take the 3 rows of white pills, and then you will ask the woman to wait for her period. Once the period starts, she can start taking it from the second day of the period. As a result of this thing, using the combined oral contraceptive pill, what will happen that the woman will have decreasing the amount of the bleeding because of decreased amount of the bleeding, as well as the woman will have lesser bleeding. It will have less pain, and cycles will become regular. Similarly, you can also give her oral progesterone. The oral progesterone can be given from the day 5, and it can be given for 21 days. So we ask them to take for 3 days, for 3 weeks, sorry, for 3 weeks, and we started from day 5 of the menstrual cycle. Similarly, we will have injectable progesterone like Depo-Provera, which can be given after 1 month or which can be given after 3 months, depending on the prescription which you are having. Similarly, there can be non-steroidal anti-inflammatory drugs like constant like ibuprofen, which you can prescribe to these women. Similarly, there can be GnRH agonist, which is usually available in the form of I'm telling you the name of the drug, which is available in Pakistan, with the name of Lactrin 3.75 milligram, which can be given every month for 3 months to stop bleeding. So and then we will come back when we can give GnRH agonist. The GnRH agonist can be given in the treatment of leiomyoma. Number one, to control the blood loss, to decrease the size of the leiomyoma. It can also be given in cases where you want to give where you want to stop the bleeding. It can be given at that time as well. So these are the different drug options or medical options which can be given to the woman for blood loss and for the treatment of heavy menstrual bleeding. We discussed this thing, and the leiomyomas. The leiomyomas, what are we going to do with them? So we talked about Levonorgestrel intrauterine device with an undistorted uterine cavity. What does it mean? It means you are not having any submucosal fibroid. You are not having a fibroid which is the size of which is less than or more than 4 centimeter, because once anything which is inside the uterine cavity will prevent the intrauterine system in firm lodging, as a result of which it will come out. Combined oral contraceptive pills can also be given to decrease the amount of the blood loss. It depends on the size of the fibroid. Non-steroidal anti-inflammatory drugs like ibuprofen, like mefenamic acid, tranexamic acid, danazol. If medical therapy fails, then we have to go for uterine fibroid embolization, or we have to go for other forms of treatment. So we discussed the medical management. There are other things like inherited bleeding disorders. हम इसमें क्या करते हैं? Anticoagulation therapy के अंदर हम क्या करते हैं? We will come back to inherited bleeding disorders in a moment. There's a lot of disturbance which is going on at the back, and it's very disturbing. I lost my concentration. So we talked about Mirena. I hope you understand it. Mirena, Mirena, and we also call it as levonorgestrel, releasing intrauterine system. Uh, this one is showing what will you do if the woman is in different age groups. So 13 to 18 years of age. You get harassed mothers bringing their young girls that the woman is have either not blood, or if once she has started bleeding, she is not strong. This then you need to sit with them and you need to tell them it's because the hypothalamic pituitary axis have also started to function now. For good 12 to 13 years, it was lying dormant. And once it has started functioning, it will take a little while to adapt. It will take a little while to normalize the thing. So you need to reassure them. Then we have polycystic ovaries for those parents who encourage their children to have lot of fast food, lot of junk food, lot of McDonald's, lot of French fries, lot of big girls weigh 75 kg or 80 kg, and then they are coming with their normal uterine bleeding and this inherited bleeding disorder. This will also come in the earlier stages of early menstrual cycle. Like once the woman starts their periods, then they will be having they will be coming to you, as we showed you one of the presentations which we had. So again, the treatment will be same. These are the girls in whom you would like to put them on low-dose combination hormone and contraceptive. As I told you, the three lines of white pill and one line of brown pill. The brown pill contains only parasulfate, nothing else. So the commonest one available is Stabilio 28 or Novada 28, where you can start them on the second day of the cycle, and then it can be completed for a long period of time. Once at least for 3 months, and then you can review whether you would like to continue it or not. If the woman is in this age group, this is the age group where people are completing their family. They have not completed their families. They are looking for more children. And here it can be, again, it can be polycystic ovaries, it can be obesity. Pre-malignant conditions or malignant conditions are seen only in those women who have not given birth to any child, number one. They are obese, they are diabetic, they are hypertensive. Then we can have endometrial hyperplasia in them, and it can be due to endometrial pathology. And Once this age group has passed, so again there will be acute abnormal uterine bleeding where you will be giving them tranexamic acid. You can have parenteral progestogens. We have parenteral progestogen, but we don't have parenteral estrogen. And then you can put them on oral progesterones for longer intervals. Similarly, we have levonorgestrel intrauterine system, and similarly, you will ask these women, especially those with the polycystic ovaries, to decrease their weight. Once the weight becomes normal, most of the things do settle down. This will also affect the thyroid levels and rest of the things. If the woman is 40 years or above, so you will be more cautious and you have to find it out that there is no endometrial pathology, there is no ovarian pathology. You have to rule out. Now we are you guys enjoying this talk or not? I don't know. आपके responses भी नहीं है, आप chat box में भी कुछ नहीं कर रहे हैं. There is no activity on your side. Some of you may be having नींद के झोंके. It's difficult to wake up in the morning, especially after lockdown. And people are getting up at 11 or 12, and then there's this new thing. How are you going to screen the women for inherited bleeding disorders for women with abnormal uterine bleeding? Remember here, these are the adolescents, the young girls who will be coming pregnant. So we see these are the things which will ask you to take care. Periods are lasting for more than 7 days, bleeding through a pad or tampon in 1 hour with clots greater than 1 inch in diameter, resulting in anemia or void. Right? Then we can have women or girls requiring blood transfusion, as I told you in the beginning, or menstrual bleeding, which is heavy and which stays for a longer interval. Similarly, you will ask these women, these girls, their mothers, that did you have these things when you started your menstrual cycle? Is their families did? See, one Willebrand disease may be running in families if we are having intermarriages, especially um, what we see in our part of the world, in our country, is that 50% of the marriages are consanguineous, meaning we are marrying among our relatives. So it may be a first degree relative, it may be a second degree relative, as a result of which we can have one Willebrand disease in this group of women. So you need to identify that the woman is not having the child is not having one Willebrand disease or any cartilage disorder. All the inherited form of the bleeding disorder will come from this group, or it may be sporadic in nature as well. So how are you going to identify that the young girl who has come to you is not having um, uh, inherited bleeding disorder? So you took a menstrual history, the periods are lasting longer, the periods are heavy to control through the normal sanitary napkins. Bleeding is required in blood transfusions. There is family history of bleeding disorders, like she will say her sibling is also having this problem, or she will say, the mom will say that I also used to have this when I was in my younger age group. Also, there is history of heavy or prolonged bleeding after a procedure like tooth extractions, surgery, or after delivery. Um, Usually, when we see these girls, what they say that they had a fall as a result of which the bleeding did not stop, and then they were seen by the doctors. The doctors did some basic tests and then referred them to one of the centers which are offering the blood services, and this is the usual history which we get in this group of women. Similarly, the adults have got extremely heavy bleeding since menarche or bleeding requiring blood transfusions as well as clotting factor or platelet transfusions, or you can have bleeding after a normal delivery, what we call as the postpartum hemorrhage, or bleeding after dental extractions. Women will say that they have epistaxis 1 to 2 times per month, requiring more than 10 minutes to stop or needing, by the way, what is the normal bleeding time? It should not be more than 7 minutes, between 2 to 7 minutes. That's why we have written requiring more than 10 minutes to stop. Frequent gum bleeding, she brushes her teeth and finds that there is bleeding from the mouth. Similarly, there is family history of bleeding themselves. So, from these are the screening criteria on the history, from where you can identify that the woman is having some form of inherited bleeding disorder. This is our work which we did, and this is also in public domain. And you can read it if you want to read it. This was published in JPNA. It is, we got across women, the children who were brought to us with adolescent menorrhagia, and we found out they have having clansmen, or they were having gonorrhea pregnancy, or they were having gonorrhea. So then these were the these are the case reports of that how we managed this group of young girls in our setup. So this was our second publication on the topic. We have also our third publication on inherited bleeding disorders and what are the commonest one in our part, and this was published in ASH abstract group. That and what we found out last year in the ASH, what we found out was that instead of von Willebrand disease, the plant function disorders are far more common in our population as compared to the Western population, and this was also supplemented by the researchers from neighboring countries like India and other Asian countries, that platelet function disorders are more common compared to um, one Willebrand disease as reported in the Western literature. We did talk about it that what to do with the leiomyomas. We can, if the uterine cavity is not distorted much or the size is less than 4 centimeter of the submucous fibroid, we can go for levonorgestrel intrauterine system. We can have combined oral contraceptive pills, non-steroidal anti-inflammatory, tranexamic acids, and this can be done. This is in cases of the woman who have not yet completed her family fertility is still incomplete, and or the age group is such that you would like to keep her uterus, and the woman is interested in keeping her uterus. We go for euthanasia embolization for fibroid in the women, and up till now, in our unit, we have carried out 4 such procedures. This is not being carried out by us, it is carried out by the interventional radiologist at the neighboring trauma center. So, this is one of the indications for which we did the arterial embolization, and the other indication is for intravenous malformation, AV malformation, with which the woman comes down with bleeding. So these women underwent embolization in our ward. Their population were observed the size of the fiber. They are on follow-up as well. Initially, in the first month, they had to follow up us fortnightly, and now we have also increased the duration of the follow-up. The size of the fibroid reduced. So when you are doing the embolization, what is happening? You are decreasing the blood supply. You are stopping the blood supply. As a result of which, the fibroid is going to reduce in size. Bleeding also decreased. That will also improve their quality of life, and they were able to preserve their uterus, and one of them did get pregnant and delivered a baby. But there are complications with the pregnancy if embolization is being carried out. Um, One of the treatment for the normal uterine bleeding is endometrial ablation. So the endometrial ablation can be carried out if the uterine size is less than 10 centimeters and size of the submucosal fibroid is also less. There are a number of techniques. So initially, they were techniques which were introduced were called as the first generation techniques. Now we have more sophisticated techniques, like and they are called as the second generation techniques, and are called as Novosure, microwave ablation, and thermal uterine balloon therapy. And once they are used, the women report reduced blood loss in 30% of the cases, amenorrhea in 33% of the cases, whereas 20% do not report any change in their menstrual cycle. So the governing bodies like RCAG and RENICE, they recommended it is recommended to consider endometrial ablation before proceeding for hysterectomy in this group of women. We talked about inherited bleeding disorders that we also shared our data with you and told you that um, the in our part of the world, the black hole function disorders are far more common as compared to von Willebrand disease. Anticoagulation therapy, what does that mean? Anticoagulation therapy means that the woman is having anticoagulants for one reason or other reason. And what are those reasons for which a woman can be having an anticoagulation therapy? For example, if she has undergone valvular replacement, like mitral valve has been replaced due to rheumatic heart disease, or there are other valves which have been replaced because of rheumatic heart disease, the woman will be put on anticoagulant therapy for the lifelong. It depends on what kind of valves have been there. In the initial stages, when the metallic valves were replaced in place of the normal valves, what will happen is that you need to put them on anticoagulants. But the prosthetic valves, which are the newest variety which are being placed, is they may not require it for a longer interval after the initial time. So those women in whom they are on anticoagulant therapy or they have a past history of CVT, so they will be on anticoagulant therapy because of inherited thrombophilia or something else. So these are the women in whom you have to mark for who may come with the complaints of the abnormal uterine bleeding. So they will have changes in their number of the days in for which they are bleeding. They have greater number of days of menstruation. They have heavy menstrual bleeding. Most of the time, you can counsel them for tranexamic acid, combined oral contraceptives if they are not having active thrombosis or inherited thrombophilia. Similarly, you can also give them levonorgestrone intrauterine system, or they can also give them progestin and wash them for closely. Similarly, GnRH agonist can also be given for the acute control of the menstrual loss in this group of women. And what are made of clear in whom you are giving anticoagulants, and these are the women who can come back to you for abnormal uterine bleeding, and then what can be given. So if she is not having active thrombosis or if she is not having inherited thrombophilia, then combined oral contraceptives can be given. So we have told you in the beginning that when we are abnormal uterine bleeding, the topic was covered, and then we have postmenopausal bleeding as well. If the menstrual blood cycle has stopped, there is bleeding 1 year after cessation of menstrual period is termed as the postmenopausal bleeding. The exclusion requires endometrial pathology, vaginal atrophy, and cervical pathology needs to be experienced. Investigations include the transvaginal ultrasound, endometrial biopsy, and other imaging techniques like MRI to identify from which to identify the cause of the bleeding. Um, The postmenopausal bleeding will again be covered when we are talking about the endometrial cancer. But right now, we are stopping here and I'm waiting for your questions. If you have, put it in the chat box and we'll try to answer those questions if you have noted them down. So I'm waiting for your questions. If there are any, and hey guys, have you gone to sleep? No questions? No, no, no. Don't take me wrong. Tamoxifen is a cause, as well as in the treatment of heavy menstrual bleeding. How? No. Tamoxifen is given as a drug to control the growth in breast cancer. So the woman will be having it for whole of her life in different doses. So once a woman is taking tamoxifen, there can be abnormal uterine bleeding. And this abnormal uterine bleeding is due to endometrial hyperplasia. So it is a cause of it's cause of abnormal uterine bleeding. And it's not a treatment of heavy menstrual bleeding. That's the disadvantage of doing when you are not able to make yourself clear. And this is also fault on my side that I was not able to make it clear. I hope it is clear to you now. It is the cause of abnormal uterine bleeding. It is not a treatment of heavy menstrual bleeding. And my dear, it was not tamoxifen as a treatment. It was tranexamic acid, what you call as tranexamine is a treatment. Okay, this is tamoxifen. That is tranexamic acid. Tranexamic acid is the treatment and not tamoxifen. Tamoxifen is the cause of abnormal uterine bleeding. बच्चों क्या सब समझ आ गया No further questions?
Leo? Leo? Madam? हेलो
बजाज बोलो।
मैडम का लेक्चर खत्म हो गया है क्या?
लेक्चर एंड है ना जी।
ठीक है
क्वेश्चन
ठीक
थे बस स्टूडेंट से
है।
कुछ।
क्वेश्चन तो सिर्फ और सिर्फ एक ही आया हुआ है, मैडम को बोलेंगे चैट देख लें।
मैडम ने वो चैट में जवाब दे दिया।
अच्छा 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 अच्छा, मैडम ने दे दिया है जवाब।
लीव लीव कर रहा हूँ सही मीटिंग।
चलें चलें, ठीक है, तारिक हूँ मैं
ओके
शारिक।
तारीख।
ओके, अल्लाह हाफिज।